So as we've highlighted, this course is not here to demonize neck manipulation. In fact, on the contrary, this course is here to help empower you to make the right choices with the right patients and choose the most appropriate and safe technique for them. And if that technique is cracking the neck, brilliant. But if that technique is mobilization, maybe soft tissue work or acupuncture, then at least we understand there's an alternative. Now, guys, it's imperative that we understand when manipulation should and should not be used. Also, understand that just because a technique is popular on social media doesn't necessarily mean it's ethical, safe, or valid. You have to ask yourself constantly, is this technique appropriate for this person? Is it clinically relevant? Have I done full due diligence? Have I done a full case history? Is there a safer, gentler, and easier alternative that will elicit the same neurophysiological outcomes that I'm trying to get from this modality? And I think that's really, really important as part of this shared decision-making and clinical thought process. If I have a patient with neck pain, I can, for example, strap the head and yank it as hard as I physically can in order to create a click and a temporary neurophysiological outcome. But we have to consider risk versus reward. What is the risk of the technique on the underlying neurovascular structures, the soft tissue and ligaments, versus the reward of this temporary neurophysiological outcome of symptomatic modification and functional modification? Can we do the technique safer? Is there an alternative technique that may be more appropriate? Does the patient understand the full risks and the options available to them? You have to constantly be questioning yourself when you're choosing what technique to use for that person. Now, I am not demonizing all manual therapy techniques or all manipulation techniques. Every technique has a validity. It has an effectiveness for the right person at the right time for the right condition. But doing the same technique to everybody regardless is not therapy, it is brutality. There's no difference between the therapist that just smashes everyone with no clinical thought process and one of the hairdressers you see in one of those countries that are cracking the necks out of people for no reason. Let's be safe, let's be ethical, and let's be clinical. If you want to manipulate the high cervical spine, there are so many ways that we can do it, which minimizes neurovascular and ligamental instability or structures. There's so many ways that we can do these techniques that elicit the outcome, but in a much more gentler and safer way. We shouldn't have to smash the patient in half just to try to make them feel and move better for a short period of time. So what I say to you is there's no bad technique. There's only a bad therapist choosing the inappropriate technique for the inappropriate patient. Choosing techniques when not doing full due diligence leads to problems. So before you click, think, is it appropriate? Is it safe? Is it clinical? Is it ethical? Does the patient understand exactly what it is we're trying to do? And are there alternatives? Is there an easier way to do this? Is there a gentler way to do this? Can I elicit exactly the same neurophysiological outcome with a different modality? Just consider these as you're going through the treatment process. And always remember, just because it looks popular on social media doesn't mean it is ethical, safe, or clinical.